All right, welcome back. Hope you had a great week. Today we're continuing a review of our third practice exam, where we're going through the next 10 questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for this practice exam and all our other practice exams, please visit bcbastudy.com. We also offer a full task list study guide, a combo pack, which includes everything, plus flashcards. We just added flashcards, so be sure to check out all those materials. Congratulations to all the BCBAs who recently passed using our materials. We're so happy for you. When you do pass, let us know and we can include you in our shout out. Other than that, let's keep working hard, keep studying hard, and get to our questions. Question 1. Bryn is taking data on task behavior for the students in her class. If she wanted to increase the on-task behavior, what type of discontinuous measurement should she use? First things first, and this is a tip that I get a lot of feedback on that people say help them on their exam, is asking what does the question want to know. It's so easy to read the question too quickly, jump to the answer choices, jump back to the question, and get lost in what you're trying to accomplish. Remember, our goal is to answer the question. So the first thing we need to do is identify what does the question want to know. And in this case, the question wants to know what type of discontinuous measurement should she use. So just by identifying discontinuous, we can immediately eliminate duration. Now we have whole interval, partial, and momentary time sampling. So we now have to ask ourselves, what are we trying to accomplish here? Okay, well, we want to take data on on-task behavior. We can take on-task behavior for all three of these, right? Whole interval, partial, and momentary time sampling can be used to take data on on-task behavior. No problem. But she wants to increase the on-task behavior. So which one of these is going to be best if we want to increase on-task behavior? Well, if you think of momentary time sampling, we are recording a behavior that occurs at the very end of the interval, meaning it could potentially overestimate and it could potentially underestimate behavior. It's going to be very hard to get a consistent look at, are we on task or not? Because we're always looking up just at the end of the interval. So it's not really going to be the best if we want to consistently increase the behavior. So now we have whole and partial interval. Well, if you think about partial interval, if our interval is 1 minute and we want the client to be on task for 1 minute, if we're using partial interval, they only need to be on task for a single second out of that 1 minute for it to count. Therefore, our data is going to be very skewed if they're on task whatsoever. We want them to be on task the entire time. So if we want to increase the on-task behavior using discontinuous measurement, whole interval is going to be our best option. This is how a measurement's going to work on the exam, right? We really need to break down pros and cons of each type of measurement and what is going to be the most effective at achieving our goal. And that starts with, of course, understanding what the question is asking. Question 2, Dr. Watson puts on a rabbit mask, stands in front of a class, and a loud siren is played, causing the class to jump. Now, whenever Dr. Watson shows the class a bunny, the class jumps. The bunny is considered a what? If you've been studying and you've read this question, you might be familiar with Dr. Watson and his rabbit experiment. It didn't necessarily go like this, but it was based on that experiment. And you're probably already thinking respondent conditioning. You'd be correct. And you can see our answer choices reflect respondent conditioning. What is the question asking, though? What does the question want to know? What piece of this puzzle or this respondent conditioning arrangement does the question ask about? Well, they want to know about the bunny, okay? So we know Dr. Watson put on a rabbit mask, stood in front of the class, and a loud siren played, causing the class to jump. So in this case, the loud siren is most likely the unconditioned stimulus, and the class to jump is the unconditioned reflex. What Dr. Watson did was paired the unconditioned stimulus, the loud siren, with the rabbit mask, creating a conditioned stimulus. And when that conditioned stimulus, which would be now the bunny, causes the class to jump, what happened? That conditioned stimulus led to a conditioned reflex. Therefore, the bunny is considered a conditioned stimulus, right? Because remember, when we take an unconditioned stimulus like the loud siren and we pair it with a neutral stimulus like the rabbit mask, we can create a conditioned stimulus like the bunny, causing a reflex like jumping, which is a conditioned reflex. So the bunny is considered a conditioned stimulus. On respondent conditioning questions, you might not get too many. If you do, don't be afraid to write it out, right? Map it out. What is my unconditioned stimulus? What is my unconditioned reflex? What is my conditioned stimulus? What is my conditioned reflex? Yesterday, as you opened your front door, you felt something in your nose and immediately sneezed. As you sneezed, the sunlight hit your eyes. Now, whenever you open the door and the sun hits your eyes, you sneeze. This is considered what? Okay, back to back what kind of questions? Well, if you got the last question correct, this is questions way easier, right? Again, reading this, you should immediately know what kind of conditioning we're talking about, right? You felt something in your nose and you sneezed. Sneezing alone tells you it's what? Now the sunlight hits your eyes, and now you sneeze when the sunlight hits your eyes. So again, we're just creating conditioned stimuli leading to conditioned reflexes. And a reflex is part of what? Well, A, respondent conditioning. It's not operant conditioning, right? Because operant conditioning is our SRS based on consequences. And operant conditioning doesn't involve sneezing. Sneezing is a reflex, okay? Reflex goes with respondent. Response goes with operant. Out of the scope of behavior analysis? Well, not necessarily, right? It's part of behavior analysis. In practice, we won't use respondent conditioning too often, but it is part of our science. And an SRS contingency. An SRS contingency is operant conditioning. What type of contingency represents respondent? That's our SR contingency, right? Consequences don't impact our respondent conditioning. Okay, operant conditioning is based on consequences. Respondent conditioning is antecedent stimuli driven. In this case, you're pairing things, you're having reflexes, you're creating conditioned stimuli. This is respondent conditioning. Gunther read 30 pages of his book last night. He read for 45 minutes. What was Gunther's rate of reading? What is the question asking? Well, they want to know about rate. What is rate? This is the process we need to start taking. Okay, what is the question asking? Well, they want to know about rate. Follow-up question for ourselves, what is rate? Rate is frequency over time. If you get into this habit, it's going to force you to really look at and analyze the question. We're not going too quickly. You can't go quickly using this method, okay? And you're going to say, well, I have to go quickly because I have a time limit. I promise you, accuracy breeds speed, okay? When you're practicing, the better you get at doing this process, the quicker you'll get. Forcing yourself to go faster not only is going to slow you down because you're going to be misreading and misunderstanding the question, but you're going to be missing more questions. During practice, our number one objective, getting questions right. Every question you attempt, you want to try and get it right. So what was Gunther's rate of reading? Rate is frequency over time. Reading, so we have 30 pages of his book. He read for 45 minutes. So he read 30 pages per 45 minutes, right? So how are we going to find rate? Well, we're just going to divide our 30 divided by 45. 30 is our frequency. 45 is our time. We divide it. What do we get? We get 0.66. We round up 0.7 pages per minute. Okay. That's how we get rate. Calculation questions should be very easy. Averages, totals, calculating rate, calculating IOA. We need to know these things. Okay. If you don't know how to calculate rate, stop here, practice a little bit, and come back. All it is a ratio. Frequency, the 30 pages over time, 45 minutes. You divide that and you get 0.7 pages a minute. Woz is a behavior analyst who specializes in OBM. He currently works for a Fortune 500 company in the HR department. Over drinks last night, Woz's coworker and friend at work says his son is starting to engage in aggressive behavior. He asked Woz if he can conduct a functional behavior assessment on his child. How should Woz proceed? What is the question asking? The question is asking about Woz's next step in this scenario. Little preview, okay? Remember, behavior analysis isn't just for autism. We have OBM, which is all business-based, but ABA is really trying to branch out into all modalities of life, okay? So you're going to get questions across several different industries. Don't panic, just apply your principles. So what do we know? We know that Woz is a behavior analyst. He works for a company. Over drinks, his coworker and friend says his son is starting to engage in aggressive behavior. He asked if Woz can conduct an FBA. So ultimately, it comes down to, can we conduct an FBA for our friend's child? Well, what does our ethical code say? So A, arrange a time, date, and payment system, and then conduct the assessment. Should we be conducting assessments and getting paid for working with our friends' children? No. We're trying to avoid dual relationships, which we're already in one here. We're trying to avoid conflicts of interest. We need to try and refer this child out. Now, there are exceptions if you're the only behavior analyst in a certain area, right? There are exceptions, but as far as we know, it doesn't seem like there are any exceptions at play. So WAS shouldn't just start the assessment if he's already friends with this person. Assuming WAS is competent in this area, WAS can conduct the assessment however he sees fit. Still an issue, right? We still don't want to be engaging in these behavior analytic practices and creating dual relationships when there already is one. C, WAS is a behavior analyst but works in OBM, so he can't conduct assessments on children. Not necessarily true. Now, of course, WAS needs to be competent in the area of aggressive behavior and child aggressive behavior, or however you want to classify this particular potential client. But just because he works in OBM doesn't mean he's incompetent. I have a past in business. I currently work with autism. Could I work in OBM? I would say I'm qualified in a way to work in OBM. Not totally, but I could do some things, right? Same here. Ethically, it says as long as we're competent in an area, we can provide services. But the key here is what? The key is WAS's coworker. It's his friend. So since this is WAS's friend and coworker, this would represent a conflict of interest, and WAS should not conduct the assessment. Now, I know I keep saying dual relationship and conflict of interest. The ethical code has actually just put dual relationships in there because dual relationship and conflict of interest a lot of times not only coincide, but they overlap. Okay. In this case, it would be a dual relationship. There's no conflict of interest yet, but there's a potential conflict of interest, right? Either way, this would represent a conflict of interest because we are working with our friend in a dual relationship. Ultimately, D is the best choice. It beats A, B, and C. Okay. And that's what we're ultimately looking for, the best possible answer. This is a toss-up, or I should say a layup question. Very easy question. We need to know about our competencies. We need to know about our dual relationships. We need to know how to avoid engaging in dual relationships and potentially engaging in conflicts of interest. All of the following are considered stimulus classes except for what? Pretty straightforward definition question, right? This one is simple. What is the question asking? It's asking about our different types of stimulus classes. So now we'll just go down the list, okay, and check. Are there such things as formal stimulus classes? Well, sure. Formal stimulus classes, they might appear the same. They might be the same color, same shape, same size. They're the same in form. Maybe they're different in form, right? They're formally similar, formally different. There are formal stimulus classes, right? Things that look the same. All things that are blue might be formally similar. So formal stimulus classes are certainly a type of stimulus class. Generalizable. Now, generalizable is one of our dimensions. It's extremely important, but there's no specific type of stimulus class that is quote unquote generalizable. Okay, we have stimulus generalization, but there's not a specific type of stimuli that is generalizable or not generalizable. There is a temporal stimulus class, so you can have an antecedent or a consequent stimuli. And then there's functional stimulus classes, okay? All three, formal, temporal, and functional, represent stimulus classes. Generalizable does not. Baseline logic is composed of several parts. Which of the following choices is not part of baseline logic? What is the question asking? It's asking about baseline logic. It's a very simple baseline logic question, actually, because it's only asking about the different parts. So think about our components of baseline logic. We have prediction, or we're predicting what might occur if we don't introduce an intervention. We have verification, where we can verify our prediction. We have replication, where we can replicate what we've added to the experiment, typically our independent variable. Is accuracy a part of baseline logic? It's not, right? Accuracy is part of good data. We want to be accurate with our data, but it is not part of baseline logic. Baseline logic consists of prediction, verification, and replication. Accuracy is not a part of baseline logic. Some questions are easier than others. That's just the reality of it. There's a lot of questions. There's 185. A lot of those are going to be very easy. When you get an easy one, don't overthink it. Don't panic because it's quote unquote too easy, because I hear that a lot. Well, some of them were too easy. If it's too easy, take the points and move on. Let's not panic. Let's trust what we've learned and studied and pick our best answer. You're a BCBA and you just conducted an assessment on a client with the help of an RBT. Now that the assessment is done, you should base your interventions on what? All right, kind of a general question. I think this is good. It's straight. It's straight from Cooper, essentially, right? And what they're saying, what we should have based our interventions on what, and it's pretty common sense. Okay, all the stuff is in the task list. It's in the ethical code. So let's just take a look at our answer choices, right? Because the question wants to know, our assessment's over. We know we have our assessment. Writing our interventions, what are we going to use? Should we use client preference? Absolutely, right? Clients are involved. Stakeholders are involved. To the fullest extent possible, they have a say in their treatment. Imagine a doctor wants to give you treatment and you have no say in it. They just say, I'm doing this. You can't tell me otherwise. Or anyone for that matter. Not going to fly. Just because we work with certain populations doesn't mean we shouldn't what? Maintain their dignity, right? Part of it is using client preference for interventions. How about assessment results? Well, of course, your assessment results are going to play a part in it. That's why we do assessments. And then scientific evidence. Yes, we always want to be scientifically based in science, right? We don't want to be subjective. Okay, we're trying to use empirical studies, research-based studies, proven methods. Okay, scientific evidence certainly plays a role in how we design our interventions. So after your assessment is done, you should base your interventions on what? Client preference, assessment results, and scientific evidence. D, all the above. You observe that Timmy takes 2 minutes to answer a math problem. What dimensional quantity of behavior are you measuring? What is the question asking? It's asking about dimensional quantities, okay? Be very careful when they use dimensional quantities, because dimensional quantities are the umbrellas in which our continuous measurements are derived from. And you need to know this, okay? So if they ask about dimensional quantities, you should be thinking 3 things: repeatability, temporal extent, temporal locus. That's what they're asking about. Now, we need to derive our measurement from our dimensional quantity. So if Timmy takes 2 minutes to answer a math problem, what are we measuring? Well, we're measuring duration. How long does it take Timmy to answer? 2 minutes. So we're looking at duration. Is duration part of repeatability? It is not. Repeatability includes things like frequency. Is it part of temporal locus? It is not. Temporal locus represents a point in time. Latency and IRT are temporal locus. And then temporal extent. Yes, duration is part of temporal extent. Extent should give it away, okay? Extent. So the hardest one really is temporal locus, which involves latency and IRT, okay? So if you observe Timmy taking 2 minutes to answer a math problem and you're measuring duration, you're measuring dimensional quantity of temporal extent. And then finally, Glenn is an advertising expert who works in the automotive industry. He has to choose between a campaign advertising trucks and a campaign advertising cars. What type of analysis could Glenn use to determine the campaign he should use? All right, tricky question. Talking automotive here, we're talking advertising. I don't do this, right? I'm a behavior analyst. Doesn't matter. They want to know, can you apply our behavior principles? Behavior principles are based on behavior, human behavior. Human behavior exists outside of autism therapy, right? In this case, what is the question asking? What type of analysis could Glenn use to determine the campaign he should use? Well, let's break it down. He has to choose between a campaign advertising trucks and a campaign advertising cars. So he has 2 different campaigns, okay? Would a parametric analysis fit here? No, why not? A parametric analysis assumes we've already chosen our intervention or we've already chosen our campaign. Now we're just trying to determine how much of that intervention or how much of that campaign. Once he chooses an advertisement campaign, then he can do a parametric analysis, maybe on his budget. How much should he spend? How many ads should he run? But right now we're comparing top level things. What about a component analysis? A component analysis looks at a full package and analyzes each component of that package. These aren't a package, right? They're separate. He's choosing between this two campaigns, two separate campaigns, two separate packages. He wants to compare them. That's where comparative analysis comes into play. Understand the difference. Component and parametric usually work together. Component, you take a package and identify what component does what. Parametric, you look at individual components and how much of that component. And the comparative analysis, you're just comparing two different things that aren't part of a package. Of course, it's not functional analysis. We're not looking at Glenn or somebody else's behavior and the function of that behavior. Glenn should use a comparative analysis to determine the campaign he should use. Thank you for watching. We'll be back with our next part next Friday. Check out bcbastudy.com for all of our study materials. As always, work hard, study hard. See you soon.